To check for DR, go ahead and take your fingers and put them horizontally at the belly button. Then you're just going to lift your head just slightly, feel for when those muscles start to activate. And that might even be a little too far of a head lift. You just want the initial muscle activation. So just slowly lift. You kind of feel how many fingers you can fit in between your rectus abdominis muscles. It might take a couple times to get to feel that. You just try a few times until you can tell. And then you want to check just above the belly button to see if you're feeling that. And if it's easier, just kind of walk your hands out to see about how far it's going. Because what's happening is at some point, these abs, there does need to be tissue in between. So at some point, the muscles kind of stretch out and then they go back down. Okay? So then you can check below the belly button. Lift up. So the other thing to check is the depth. You put your fingers right at the belly button and just lift your head slightly just to feel how deep it feels. It could be a knuckle, could be half a knuckle. And you'll notice an improvement after you've done some core reconditioning and that tissue starts to tighten up. The tissue can actually tighten up before the width actually comes close together. So if you have 2 finger widths or more separation, it's recommended to use the FITsplint while doing the ReCORE program. If it's 2 fingers or less, then you can just do the ReCORE program.